Hello guys, welcome back to my channel. So today in this video I'm going to read some important information regarding COVID-19. As you see, so far the cases are increasing day by day and people are panicking, and doctors don't have much supplies over for medical and stuff, so it's giving panic attacks on people. So people are dying, and especially in Italy and everywhere it's going crazy with COVID-19. So in this I will going to read important information regarding that so people can aware of the symptoms and everything. And as you see, like, emergency declaration everywhere is going on. So what is coronavirus disease? COVID 2019. So it's coronavirus disease is a respiratory illness that can spread from person to person. The virus that caused COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. Everyone knows that it came from Wuhan, China. Can people in US get COVID-19? Yes. COVID-19 is spreading from person to person in parts of the United States. Risk of infection with COVID-19 is higher from people who are close contacts of someone known to have COVID-19. For example, healthcare workers or household members. Other people at high risk for infection are those who live in or have recently been in the area with ongoing spread of COVID-19. So learn more about the places with ongoing spread of that with this link you see, https://www.cdc.gov/coronavirus/2019-9/cov/about/transmission.html, and then geographic. So, have there been cases of COVID-19 in the US? Of course, yes. The first case of COVID-19 in the United States was reported in January 21st, 2020. The current count of cases of the COVID-19 in the United States is still available on the CDC web page. Like, you see the link. If you go through, you will see more information there. How does COVID-19 spread? So the virus that causes COVID-19 probably emerged from an animal source, but is not spreading from person to person. It's not spreading through animals, so you have to know that it's spreading from person to person only, not from animals. The virus is thought to spread mainly between people who are in close contact with one another within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. It also may be possible that a person can get COVID-19 by touching a surface or object that had the virus in it, and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spread. Learn what is known about the spread of newly emerged coronavirus at this link. Like you see, CDC government. So let's check about the symptoms of COVID-19. Here they are. Patients with COVID-19 have had mild to severe respiratory illness with symptoms of fever, cough, and shortness of breath. So if you see, in 3 words, you will remember FCS: fever, cough, and shortness of breath. If you notice someone in your family or your relative or your neighbor, someone having this problem with fever, cough, or shortness of breath, FCS, then do tell them to check with the doctor to make sure, because it's better to get treated than to, being in worse situation. So what are severe complications from this virus? Since as we are hearing, it's quite deadly, especially for the people who are 65 and above, but it does affecting younger population also. So it's not like younger population is not affecting by this. Everyone need to be very careful. So some patients have pneumonia in both lungs, multiple organ failure, in some cases death. And how can I help protect myself? So let's see how we can protect ourselves from this virus. People can help protect themselves from respiratory illness with everyday preventive actions. Like you see, any kind of sickness like normal flu and influenza thing, what you do, you have to do, be careful double with this thing. Avoid close contact with people who are sick, and avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands often with soap and water for at least 30 seconds. Use an alcohol-based hand sanitizer that contains at least 60% of alcohol if soap and water are not available. So best thing is to use the soap and water. If you're outside somewhere and you don't have soap and water available, then you can use the sanitizer, alcohol-based sanitizer, which contains 60% of alcohol in it. So, and if you are already sick with something, it should not be like COVID or anything, but if you are like sick with like common cold or something, you should better stay at home, because your immunity is like weak around when you're sick, so have to be very careful. And you're less immune if you're sick, so staying home is a best option. And if you are sick, to keep from spreading respiratory illness to others, you should stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces with the disinfectant sprays or wipes. So what should I do if I recently traveled from an area with ongoing spread of COVID-19? If you had traveled from an affected area, there may be restrictions on your movement for up to 2 weeks. If you develop symptoms during that period like fever, cough, trouble breathing, seek medical advice. Call the office of your healthcare provider before you go. Tell them about your travel and your symptoms. They will give you instruction on how to get care without exposing other people to your illness. While sick, avoid contact with people. Don't go out and delay any travel to reduce the possibility of spreading illness to others. Is there any vaccine available? Unfortunately, there is currently no vaccine to protect against COVID-19, though scientists and like doctors are still trying to find a cure for this, but it might take longer, so we have to stay home and be careful with ongoing thing with this pandemic. The best way to prevent infection is to take everyday preventive actions like avoiding close contact with people, social distancing, that's what we call, who are sick, and washing your hands often. Is there a treatment? Like we said earlier, it's no specific antiviral treatment for this disease because this is a new one. People with COVID-19 can seek medical care to help relieve symptoms, and you can go in with this link to find more information if you need it. So let's see symptoms of coronavirus disease 2019. Patients with COVID-19 have experienced mild to severe respiratory illness. Symptoms can include fever. Symptoms may appear 2 to 14 days after exposure, and then cough and shortness of breath. Seek medical advice if you develop symptoms and have been in a close contact with a person known to have COVID-19, or if you have recently been in the area with ongoing spread of COVID-19. Stop the spread of germs. Help prevent the spread of respiratory disease like COVID-19. Avoid close contact with people who are sick. Cover your cough and sneeze with a tissue, then throw the tissue in the trash. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces. Stay home when you're sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds. So what is novel coronavirus? Novel meaning new. Coronavirus is a virus strain that has only spread in people since December 2019. So we call it novel coronavirus because novel means new. It's a new virus. And healthcare professional, experts, and scientists still trying to discover the cure for it because it's quite new. It started in December 2019, so it will take time to find a cure for that, so we have to be careful. Healthcare experts are concerned because little is known about this new virus, and it has been potentially to cause severe illness in people, especially respiratory. How does novel coronavirus spread? Health experts are still learning the details about how this new coronavirus spread. Other coronavirus spread from an infected person to other through the air by coughing and sneezing, close personal contact, such as touching or shaking hands, touching an object or surface with a virus on it, then touching your mouth, nose, or eyes. In rare cases, contact with feces like poop. Now, how severe is novel coronavirus? Health experts are still learning about the illness caused by the new virus. People infected have had illness that have ranged from mild, like common cold, to severe pneumonia that requires medical care in the hospital. So far, deaths has been reported mainly in the older adults who have other health conditions. What are the symptoms? Like we know, people who have been diagnosed with novel coronavirus have symptoms that may appear in like as few as 2 days or as long as 14 days after the exposure to the virus. Symptoms may include fever, cough, and shortness of breath. Like I said, FCS is the short form to remember these things. Who is a risk for novel coronavirus? Currently, there is a widespread outbreak in Wuhan, China. At this time, there's a risk in the US too. The China public is low. At this time, there are a small number of cases in the US to limit the risk of spread. Healthcare officials are working with healthcare providers promptly identify and evaluate anyone they think may have virus. So, travelers to and from certain areas of the world may be increased risk. So, how can I prevent from getting novel coronavirus? If you're traveling overseas to China but also other places, follow the CDC guidelines at this link. Go through it and you can see. So right now the novel coronavirus has been spreading widely in the United States, so there are no additional precautions recommended for the general public. Steps you can take to prevent the spread of flu and the common cold will also help prevent coronavirus. So wash hands often with soap and water. If not available, use hand sanitizer. Avoid touching your eyes, nose and mouth when unwashed hands. Avoid contact with people who are sick. Stay home while you're sick and avoid contact with others. Cover your mouth and nose with tissue or sleeve when coughing or sneezing. Currently, there are no vaccine available to prevent novel coronavirus infection. So, how is novel coronavirus treated? There is no specific treatment for coronavirus. Most people with mild coronavirus illness will recover on their own by drinking plenty of fluids, resting, and taking pain and fever medications. However, some people develop pneumonia and need medical care or treatments in a hospital. And so, what is the difference between isolation and quarantine? Isolation and quarantine help protect the public by preventing exposure to people who have or may have contagious disease. Isolation separates sick people with a contagious disease from people who are not sick. And quarantine separates and restricts the movement of the people who were exposed to a contagious disease to see if they are become sick. So, isolation is for people who are already sick. Isolation separates and restricts the movement of sick people so they can't spread disease to healthy people. Isolation is a routine procedure in hospitals and healthcare facilities. Isolation is usually voluntary, but officials have the authority to isolate people who are sick if necessary. And quarantine is for people who are not sick but may have been exposed. Quarantine people may or may not become sick. Quarantine people may stay at home or another location so they don't spread disease to healthy people. If you're quarantined and you become ill, you can seek medical treatment from a healthcare provider. Quarantine can be voluntary, but officials have the authority to quarantine people who have been exposed to an infectious disease if necessary. So this information is really important. So stop germs and wash your hands when after using the bathroom, before, during, and after preparing food, before eating food, before and after caring for someone at home who's sick with vomiting or diarrhea, after changing diapers or cleaning up a child who has used the toilet, after blowing your nose, coughing, or sneezing, after touching an animal feed, or animal waste, after handling pet food or pet treats, after touching garbage. And how? Wet your hands with clean running water, warm or cold, turn off the tap and apply the soap. Lather your hands by rubbing them together with the soap. Be sure to lather the back of your hands between your fingers and undernails. Scrub your hand for at least 30 seconds. Need a timer. Hum the happy birthday song from beginning to end twice. Rinse hands well under clean running water. And dry hands using clean towel or air dry them. So keeps hand clean is one of the most important things we can do to stop the spread of the germs and stay healthy. I guess you guys have lots of information today about the COVID-19 and how to stop the germs. So alright, so I'm concluding this video now and hope you guys like my video. So please don't forget to subscribe to my channel and post on the notification button. Till then, take care. I will come with more stuff soon. Bye.